I'm Devin with Intermountain Orthopedic Care. We're going to be talking about compression socks today. They help a variety of issues, from as small as maybe you have an ankle injury that just can't get that swelling out. The compression sock can help with that. It can help decrease some varicose veins and spider veins that people have, especially during pregnancy. It's an important time to be wearing compression stockings. It can help people with lymphedema. Lymphedema is a disease of the lymph node system, and that can cause lots of swelling. Those require a higher compression, a more robust sock. It can help with to fight DVT, so that people don't get deep vein thrombosis. You don't want to use them if you have a current deep vein thrombosis, but it can help to prevent you from getting those swelling in the leg from an injury, or just blood pooling, as we mentioned earlier with the venous insufficiencies. I'm going to show you how to put a pair of socks on. The important thing is that you need to get a correct fit. You get a measurement just above the ankle bones. I like to do it in centimeters. It's a little more accurate. The next measurement is around the calf, around the widest portion of the calf. And then you're going to get a measurement from the bend of the knee all the way down to the floor. Sorry, 23 centimeters on the ankle, and he was at 39 in the calf. So he fits right snugly in a size 3. Okay, so when I put them on, there are 2 ways to put them on. And that doesn't include gloves. You always need a pair of gloves to put on the socks. You want to keep your garments nice for a long time. They're expensive, and so we want to keep them. You want to keep your garments without blemishes. They can put fingers right through them. So putting them on, if you're not going to use an aid, I'll do them without an aid and then with an aid. You're going to take the sock and turn it inside out. So you're going to take the sock until you get the heel. You're going to pull everything inside out. We call this the sock puppet trick. So the heel sits nice, like so. This is the most difficult part of putting the sock on. You're going to kind of stretch it out. And Nathan, if you can lift your foot up, we're going to shove your foot in. The goal is to get the heel portion over. This is the tightest portion of the sock, sits right here. So once we get that over, everything else becomes a little easier. You'll want to work out any wrinkles like so. That's where the gloves can come in handy. You can take the glove and kind of pull up so that we can get those wrinkles out. Now I'm going to put the sock on using Medi's Butler. I like using the Butler. It's a lot easier to put on the socks. It takes a lot less effort, especially if someone has problems bending over for long periods of time. So similar to the sock puppet trick, you're going to push the sock down the half moon. The heel is going to be against the half moon portion. You're going to go until the heel is in the half moon. And you're going to take the Butler and you're going to put it on the ground. And they're going to stick their foot in, shove it in, and push like that, and go ahead and grab these handles, Nathan, and pull the sock up. And then if you have your gloves on, or I'll show you. Here, I'll put the gloves back on real quick. You can use the gloves to finish off putting them on.